I've got a lot of grandbabies, like a lot. And when it comes to finding a gift for each of them, it could add up. But this year, while I was making my way through Walmart, I realized I don't have to spend a lot to get the gifts they'll love.
An OPI mini mani set. I'm gonna do so much nail art. Oh yeah, a Lego set. My own Awala water bottle.
Ooh, and that's just half of them.
Shop great gifts they're sure to love for $25 and under at Walmart.
The #1 selling product of its kind with over 20 years of research and innovation. Botox Cosmetic, onabotulinum toxin A, is a prescription medicine used to temporarily make moderate to severe frown lines, crow's feet, and forehead lines look better in adults.
Effects of Botox Cosmetic may spread hours to weeks after injection, causing serious symptoms. Alert your doctor right away as difficulty swallowing, speaking, breathing, eye problems, or muscle weakness may be a sign of a life-threatening condition. Patients with these conditions before injection are at highest risk. Don't receive Botox Cosmetic if you have a skin infection. Side effects may include allergic reactions, injection site pain, headache, eyebrow and eyelid drooping, and eyelid swelling. Allergic reactions can include rash, welts, asthma symptoms, and dizziness. Tell your doctor about medical history, muscle or nerve conditions including ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome and medications, including botulinum toxins, as these may increase the risk of serious side effects. For full safety information, visit BotoxCosmetic.com or call 877-351-0300.
See for yourself at BotoxCosmetic.com.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode.
And we have Dr. Rachel here as a guest. So could you just introduce yourself a little bit? Tell us a little bit about your background in dentistry and where you're practicing now.
Yeah. So my name's Rachel. I have been practicing almost 10 years, which seems crazy because it goes by really fast. I have 3 sons. I have a 7, a 4, and a 1-year-old. So I just had a baby about a year ago. My husband and I have been married 10 years, and I practice in Gainesville, Texas right now. Yeah.
Awesome. And before we started recording, you mentioned that you went to dental school in Arizona.
Yes.
What led you to go to dental school there?
So I went to school at Midwestern University in Glendale. I applied to about 12 schools. I had interviews with about 9, but I only went to 5 of them. And I'm from like a huge family of dentistry. Like my dad and his twin are both dentists. And then I have a brother that's an orthodontist, and I have 3 cousins that are orthodontists. So it's like huge. There's so many of us, but my brother went to Nova Southeastern in Florida, and so that was one of my top picks because it's a good school. But Midwestern opened probably about 3 years before I applied because I was the 4th class of like the first classes, and it was a new school, so everyone's like, oh, is it going to be good kind of thing. But I was dating a kid from Arizona, so that's really the draw for me. But also when I interviewed, I felt like, okay, I felt home at this school. It's a great school. I highly recommend it. If you're out there looking to apply, Midwestern should be like one of the top schools. I came out like knowing so much and having so much experience that I just could like hit the ground running when I first started practicing, which I think is some schools don't have that, and it's so needed if you're going into like an associateship or into private practice or even into corporate. Like they want someone who can like step in and do like general dentistry at a quick pace, like that first day kind of thing. And I felt like Midwestern was really good about that.
That's awesome. Yeah, it seems like that's kind of a stark contrast among schools.
Yes.
And like even different like regions of the country right now, where it seems like the East Coast is very like you must do residency before as a general dentist, like you won't be competent otherwise, and it kind of scares people. But then I feel like the rest of like the middle America is like you can do it, just go to a school that's going to prepare you. So that's kind of where I was at. Yeah, I didn't feel like I needed to do a residency to go right into practice, but I also wouldn't have gone like start up right away or practice without any other doctors in the office. So what was your experience like right out of school? What kind of practice did you enter into?
Yeah, I feel like back in the day, like my father's a dentist, and so I feel like back in the day, like people went into like startups so much more than they do now. And I think it's how we've changed general dentistry, because general dentistry is not just like routine fillings and crowns as it used to be, and I would refer all the other things out. And so now I feel like as general dentists, we're more like I hate to say super dentist, but we do like a broad spectrum of dentistry, which is not like my father thinks it's like the most craziest things that I like place implants, take out wisdom teeth. I used to sedate people and he just thought that was like mad. Like, you cannot do that. You are a general dentist, Rachel. So I wanted to do a broad spectrum. And so my father's a dentist. And so initially my plan was to go and take over his practice. I met my husband and I always had this like burning instinct that I wanted to learn from someone who like did a lot of broad spectrum stuff. And I knew my dad, he just does fillings and crowns. Not that that's bad. That's just kind of how it used to be. And doesn't root canals or anything like that. Like that just not, he just refers it out, which is great. And sometimes that's even what people do now. But I wanted to do more. And so there was a professor in my dental school that had a brother that was looking for an associate. And I interviewed with them and it was a good fit. There was 3 dentists. At the time it was a good fit. There was 3 dentists and then there was me and I was the associate. And so they owned the practice and I was their like first real associate. They had like older gentlemen that were like filling in kind of things, but not like a true like right out of school associate. And that was me. And so the first like little while you're like getting your feet, it feels overwhelming. Like, how am I ever going to see all these patients in one day? Like, so it was good that I had that because I thought about doing like an AGD. Is that? No, AEGD or GPR. But I was like, no, I just want to start practicing. So it was good because there's a huge practice. There's 13 ops. They had 5 hygiene. It was just very high production. Like you were seeing so much stuff, which was great at the time because I really wanted to learn from that. And the one dentist, he had done an AEGD in the Army, so he was pretty specialized. He did root canals and implants and lots of wisdom teeth. And so I'm like, oh, this is going to be good because I'm going to learn from him. The other guy was very cosmetically driven, so I'm like, I want to learn that aspect of it. And so the other one was just more like a routine general dentist, but it was great. So I loved it. My first couple of years, it was great. And then I had my first baby. And at that time, I had this like feeling inside of me that I wanted to do more. I wanted to own more of the practice. I wanted to like have more say in things of what I was using, because as an associate, sometimes you just get given like, this is the composite we're using now. You don't have a say. Here you go, use it. And the employees, like, you don't really have a say in like who you work with or like if you like them or if you want to like give them a promotion or like a bonus or anything like that. You don't really have a say. You say things, but you don't really have anything. So I started to have that like burning inside of me, like, I want to do more. So before I went back from maternity leave, I was like, I want more. If you can't think that is possible in this practice, then I probably am going to kind of look elsewhere kind of thing. And they said, no, we actually want to open another practice in a neighboring city. And so I thought, okay, cool. And they said that would be your practice. You would have part of it. And I'm like, this is going to be great. You know, this is what I've wanted. I wanted to own more. I wanted to have more say. So time went on. It took a while for the practice to get going and starting. Actually, I had another baby before it got ready. So I came back actually after my second baby, right after maternity leave, into the new practice. And that was my practice. And so they had said, like, you're going to have ownership in it. But as soon as it started, they're like, you know what? We're going to change things and just kind of pay you at a different pay rate, but you're still going to run the practice, you know. So I had it, but I didn't have it. And so I practiced there for a while and it took off. Like that practice, we built it up so quickly. It was neighboring. So I had all my patients that I had been seeing for about 4 years. They kind of followed me. And so it had like a good patient base. And it like, I mean, now that I had this practice, I'm like, wow, that was crazy how quickly it built. So it was good. I liked it, but I still had that like, wait, I'm just like making, I hate to say it, but I'm making money for these guys and I'm not getting the full benefit of like having true ownership and all that. And I had say, but I didn't have say. So my husband's boss is an attorney. So my husband's an attorney and my husband's boss is an attorney, obviously. That was a stupid comment, but she wanted to move to Texas and she put it out to my husband that we could move with them and start like a firm here. And so I'm like, okay, like the itch kind of started and I'm like, this might be a good opportunity because I kind of felt like at that point I was never going to actually own part of the business. It was always going to be like, maybe down the road you could buy it, maybe down, that kind of thing. Because yes, we were doing really well, and it was benefiting them to keep it this way, if that makes sense. I decided to move to Texas. And I thought it would be a good change. It was good. So I looked at jobs of what to because I didn't know if I wanted to buy a practice or start a practice or what to do, or be an associate in Texas for a while and then go continue that way. So I found a practice up in Gainesville. So I live in Argyle, which is 35 minutes south of where I practice. But I found a practice. It had been closed for a year. The dentist that owned it, or the company. So I am the owner of my practice. So I bought into a practice, but I am part of a DSO. So it's a little different than complete ownership, but it's night and day different. People, I think when you say DSO, they're like, holy crap, you're part of a DSO. It has a root canal feel to it. When you say to a patient, you're going to have a root canal, they're like, oh, a root canal, or DSO, they're like, oh, a DSO. But I think there are very broad spectrums of DS, how a root canal can be great, and then sometimes it can be bad. But my DSO is and I went in telling them, I don't want to be part of a DSO. I was part of this practice. I had no say. I do not want to do that. I will not do that. And they said, we will have you can buy into it and it's yours. I have 100% ownership of it, and they're basically the financial backers for me, which is great. I rarely interact with them. They run my payroll for me, and then help me keep up with all my compliance stuff. So that's great. They don't make any of my treatment planning, which some DSOs do. They have no say in that. I won't ever let them have say in that. They don't have any say of what I have to order or what I use, which is I wouldn't be part of a DSO that was like that. I couldn't, because I was there for 6.5 years and I just couldn't do it anymore. So basically day-to-day operations, I run the whole practice. I have say in who I hire. I don't even have to ask them if I'm hiring anyone or firing anyone. I just do it, and then really they just run my payroll and help me with all my compliance stuff, which is great. And then at the time, it was better financially for my husband and I to have that help with them. And I am a mom, and so I'm not saying that moms can't own a practice, but for me, it has been, at first I was very questionable about how it would work out, but it really does help me just be able to have more of a balanced life. So the practice had been closed for a whole year. And it was in this old house that had mice in the floors. Not I hate to talk bad about it, because it was at one time a really cool practice, but just throughout the years, different ownership. And then the last year they had 9 doctors in there, just no one was taking control of it. And so I took it over. I bought it with sight unseen. That show where you buy a storage unit and then you go open it and you're like, holy crap, what did I just do? So that was kind of what it was. I looked it up online. They showed me the numbers of what it could do, and I'm like, you know what? Let's just do it. I was feeling I don't know. And then I had major, I got here, I looked at it and I was like, I gotta do this. Is there any way I can sell it back to you? I don't want it. But they said, no, we are going to help you. So we worked out a deal where they helped me to build a new practice in a different location in the same city. Brand new. So it's very high tech. It has all the things that I wanted it to have without having mice in my floor. So it took a while for it to be built, so about 9 months. So I did temp, which was a weird experience for me because, it was very, very weird. Because you're just I'm only going to be here 6 months. These patients, it was just, I do not like temping. I probably would never do that again. But then my practice got built and we opened September 2022, which is great. I got to design it all, which is great. Pick all my, what I was going to use in the op, which is what I really wanted. What different systems I can in place, and if I was going to use organization, all that kind of stuff, and the employees that I was going to have, which was fabulous. We opened, and the first year was so slow. It was scary slow. It was so terrifying. So if you're going through that where you're opening a practice, the first year is so scary. You are regretting every decision you ever made, thinking that it will never get better. You have, you're mad, crazy. everything is very questioning. You're questioning literally everything. So, and like you see maybe 3 patients a day and you're thinking, I don't even know if I'm going to be able to pay my employees, let alone myself. But luckily the first year it was just the first year. But I got pregnant unexpectedly. I had a miscarriage, and then we were like, okay, let's not try for a while because that was very hard for me. So no, so it was very hard. So I'm like, no, it's not. I can't do this. Opening a practice. But then I did get pregnant. So I was pregnant the first year of being open too, which is just like a whole nother layer of like craziness. And so we had been open. I had my baby August, and so we've been open a year in September. So like during my maternity leave, we opened a year, and I didn't want to miss out. It's my 3rd baby, so I thought about just like going straight back to work because I didn't want to leave my patients that I've been trying to build this practice for a year. But I found some temp dentist to help cover me, and I was only gone 8 weeks, and then I came back, and then it was crazy. As soon as I came back I feel like people were like, she's here, she's back, because we had a few patients that had stayed even though they had such craziness and they'd been closed a year, so they had come back. My hygienist that I have now was with the practice for like 25 years, so she's like the sole reason that we had patients the first year, and I like will admit that to everything, because without her we wouldn't have had very many. So luckily, as soon as I came back, things started to really pick up, and it's just been so the first year I had 3 employees. It was my front desk, my hygienist, and assistant. It was like a skeleton crew. So if one of us was gone, it was crazy. And then after that, I hired another assistant because we got so crazy. I wasn't able to do it with just one assistant. And then the front desk got too crazy, so we hired a part-time front desk, and now we just hired another part-time hygienist. So now we're at, what would that make? 7 people in the office. So it has been night and day difference of what I did our first year to the second year, and it's just like our hygiene, before we hired the part-time, she hasn't started yet. We were booked out till like the end of January. So it was crazy. So, but yeah, so that's my story. I do all broad spectrums of dentistry. I place implants. I do overdentures. I don't do all on 4s. I have done one case when I was an associate, but I feel like I just need to really work up to that. I would love to do it. It's something that has always been like a dream of mine, to help restore people more permanently, more efficiently, more effectively. But I just don't have the training quite yet. So I do overdentures, implants, wisdom teeth, and root canals, and I love cosmetics. So it's fun. It's very fun. Yeah.
This episode is brought to you by Allstate. Some people just know they could save hundreds on car insurance by checking Allstate first. Like to check the date of the big game first before you accidentally buy tickets on your 20th wedding anniversary and have to spend the next 20 years of your marriage making up for it. Yeah, checking first is smart. So check Allstate first for a quote that could save you hundreds. You're in good hands with Allstate. Savings vary. Terms apply. Allstate Fire and Casualty Insurance Company and Affiliates. Northbrook, Illinois.
When unprecedented times are all the time, it's time to start walking the talk with PwC. Leaders like you turn to PwC to see and stay ahead. Upskill your workforce, use intelligent automation, and transform big ideas into breakthrough outcomes. Explore the human-led, tech-powered solutions that help you thrive. It's all part of PwC. Learn more at pwc.com.
Being an MDA member isn't just about dentistry. It's about making a difference. When you join the Michigan Dental Association, you're securing your spot at the top of your field and helping communities across Michigan through initiatives like the Michigan Dental Association Foundation. And you're able to get really plugged in with your local component, which has been really the biggest benefit for me with my MDA membership. So let's shape the future of dentistry together. Visit michigandental.org/2025 to secure your 2025 membership today.
That's awesome. Thank you for taking us through kind of step by step all the process that you've been through so far. I'm definitely going to ask kind of different follow-ups about like each little phase of that. But I guess going back more towards the beginning, when you were coming out of school and you were working in that practice with a lot of doctors that kind of had different skill sets, that reminds me a lot of where I am now at my associateship too. Like each of the different doctors has something that they're really passionate about, and that's what mostly they practice, as well as a little bit of the typical general dentistry. And I'm kind of trying to decide how to most effectively learn from them, you know? So what were some of the ways that you tried to learn from these doctors? Did you block off your own schedule and observe them in procedures? Did you just do that when patients would cancel? Did you stay after hours and pick their brains? Like, how did you kind of maximize that opportunity when you were an associate?
That's a great question, because I feel like a lot of associates have that, like, how do I learn? And from the doctor who did a lot of surgery, it worked out well because he also sedated patients. So obviously the patient knew that I was going to be doing it, but he was in the room sedating the patient, because at that time I didn't sedate. Um, but he would be there kind of step by step. So like I did place implants in school, so I did have some, but not as much as what I would need, you know. So he was in the room kind of guiding me step by step of what to do and what to look out for. And so I did a lot of cases why the patient was sedated and he was hanging out in the room, because it's always awkward if there's another dentist in the room, like the patient, you don't want them to feel like you're not capable of doing it. And so that worked out well for us. The patient was aware that I was doing it, but he was helping oversee me. I think we gave him a discount or something just so that, you know, I don't know, kind of thing. So I did that a lot for my first implant cases, like a ton. Same thing with wisdom teeth. He would sedate the patient. We would do days where we would sedate. This is when I started sedating patients. Like we'd both sedate the patients, but then we were extracting wisdom teeth. And if I had an issue, he would be there and he would help me take out. I do the motion of taking out an upper, just like that. So that was the main way that I learned to take out wisdom teeth, was that and place implants. I did do some courses as well, but I think that was that was so vital for me to feel confident. Also, they were always there, and so there'd be times where I'm like, I have a question. And I wouldn't tell the patient that. I'd be like, okay, I'll get you, just hang out here. And then I would, if they were in their office, we ran upstairs and I'd be like, hey, I can't get this tooth out. Any tricks? What do you got? Like that. I'd tell the situation and they'd be like, okay, you're going to go down, you're going to use this, and then you're going to do it. Or one time I cut the patient's floor of the mouth and I was like, what should I do? I don't know what to do. They didn't teach you in dental school. What do you do? Cut the floor of the mouth. What should you do? So I was like, put some gauze there, ran upstairs. Do I need a suture? What do I do? I explained what it looked like. They said, you don't need a suture. You're good. Gauze, and then the patient can, be okay. That kind of thing. With the cosmetics, I would review a lot of my cases with the dentist who was more of that, like, what would you do in this situation? And then with Invisalign, same thing, like review my ClinChecks with him. Like he also did like conventional bracketing. So he had a lot more of that ortho background than I did. And so I'd run my ClinChecks, like, do you think this looks okay? Is this going to move? What do you think here? He was also new to Invisalign, so we were kind of learning that at the same time. But I felt like because he had that ortho background, he knew more what teeth could do than what I knew. Because in dental school, our ortho education was not great. I wouldn't say they were great at that time at Midwestern. So yeah, that was really helpful. But the cosmetics is always tricky because, again, you don't want the doctor in the room and you're not like, but I'd peek in, I would say, hey, can I take a look? Can I see? And then like look at how they were prepping things and kind of apply that to mine, or just kind of pick their brain, like, how would you go about this? There's multiple times where I would actually assist. I could get away with it more because I'm a female. And then sometimes the dentist, like the patient didn't know if I was the dentist, I'd just be like suctioning and they'd think I was an assistant. But I was actually like watching what the dentist was doing, like removing a mucocil or like doing a frenectomy, those kind of things I'd never seen before that I didn't do in dental school, but I wanted to do it. And so just like pop in, watch it. And then the next time, I feel like once you watch it in person, because you have the skills, your hands are good, you're good with your hands. So I feel like you watch it once, you can do it, kind of thing, kind of talk it through, make sure you understand what not to do and what could happen if you do things that you're not supposed to do. Make sure you're aware of those. But yeah, that was majorly what I did. Ask a ton of questions, just kind of sit and listen to their stories about things that had happened to them to make sure that it doesn't happen to you. I think they learn a lot from that, actually, is people's bad experiences, so that you know what not to do so that that doesn't happen to you, because it does happen. The human body is different and unpredictable at times.
Definitely. Well, that was really helpful. I mean, for me personally, so I'm sure people listening will learn from that as well. And when you were back at the associateship and you had your first baby, would you say you preferred the experience of being pregnant and however long you could take off? Was it easier as an associate or was it easier when you were a practice owner?
Easier as an associate, like hands down, because I just like my baby came 3 weeks early, and I just see you guys in 10 weeks, and I didn't like they were able to cover my patients that I had, and I didn't have to worry. I wasn't stressed. I wasn't worried like the practice was falling apart. It was just running as normal. I think they covered part of my like they would like there's a couple that they covered a couple of my like I wouldn't say shifts, but they covered for me kind of thing. So maybe it was more of a burden for them than me, but I took 10 weeks off with my first baby, and then I went back part-time, and then I went back full-time I went back part-time for a month and then full-time again. So it was way easier, yeah, because 3 weeks early, having a private practice would be quite hard.
Yeah, if you're not
Yeah.
prepared. I mean, there's
Yeah.
like, I would imagine that was the answer, but I was curious what you
Yeah.
thought of that. And this is, I mean, even a little bit more personal, but if you're open to kind of sharing what you've done, or if you have friends with the fact that you don't have an income when you're not working as a dentist, how did you and your partner kind of plan for that when it came to the time off that you'd be taking?
Yeah, that is hard. It's so hard because if you're not working, you're not getting paid. I did have like you trickle, you have that 60 to 90 days. So they kept paying me off of the production that I had. So there was a little bit. I also had a scholarship when I first started practicing in the state. They wanted me to come back and they would pay like a certain amount. So that actually saved us the first time since that money was coming in. And so we had like extra that I didn't really make. So that was great. The second was during COVID. And so actually the PPR, what was that called? That loan that people got, that actually helped us, sadly, because I was able to take it out because I had my own company and I had nannies, and so I did have employees. So they actually gave me, it wasn't like a ton, but they did give me, so that actually helped us. And then this time it was it was awful. It was definitely hard, and mostly because the income before that was minimal because we had just started. So I would say, I mean, people have savings and things definitely before you go 6 weeks without having paid, because then you have to think once you come back it's not going to be as much because you have to wait for that income to build again. And so that is definitely something. I mean, my husband works too, he's an attorney, so it wasn't like we had definitely funds and things, so it wasn't like a single income. That would be very hard. Yeah, very hard if you were a single parent, for sure.
And besides preparing financially and like knowing you were going to take some time off of work, is there anything that you personally did or you and your husband did to kind of prepare for starting that journey of having kids? And I guess maybe like professionally, did you go through any back and forth, like, do I want to stay home more and always be part-time? Or did you have any of those debates about like if your life would be different once you started your family?
For sure. Yeah. That's why I first went back for a month for part-time, because I kind of wanted to see how it was for me. I mean, I have a lot of student loans. So in my mind, there's never a question of not being able to work full-time at this point in my life because of my student loans. Ideally, I mean, a 3-day work week for me would be great, but it hasn't ever had the opportunity to. I hope in the future it will, so I can spend more time with my kids. Just right now, it just hasn't laid out. Being pregnant and practicing, I don't think most dentists will understand it, and even like assistants won't understand it. It's hard. Like your body's drained, your mind's drained. You're worried about like if you're gonna be a good mom. No, I'm emotional. But yeah, so I think that was something I didn't prepare for, is how you would feel after going back to work, like feeling like, ooh, I left my baby. Can you tell that it's still emotional? Sorry. My
Okay.
baby's only one, so I'm still like, ooh, hormonal. But yeah, so I think that is like very mental, and I don't think anyone really prepares you for that until you go through it. It's definitely harder than you expect it to be.
Yeah, I'm sure. I appreciate you being so
Yeah.
vulnerable and willing to kind of share. And it's like it's so much of the percentage of practicing dentists now are females, and it's only more and more. So it's important to talk about it more and bring to light
for sure
people's experiences with that.
The guilt gets better. Like I feel like you kind of just like push it aside, but it's always there. Like you always feel like, shoot, am I doing what I should be doing? But I love dentistry so much, and I know I'm helping, and where I'm at right now is really good. So just know it happens to everyone and you're not alone. I had a friend that just went back, and she was like, first baby, she's like, this is the hardest thing I've ever done. And I'm like, yeah, it really is. It really is.
And I also, part of being pregnant and practicing, like I think about the times when like the patient's basically sitting in my lap already and I don't have a month.
It is so hard to see.
Like, I can't imagine what it's going to look like, and like how you have to weirdly position yourself when your body's already like probably all sore and achy. It'll be interesting. I do still plan to have kids, but I'm curious what that's going to be like.
I mean, I feel like because it grows slowly, you kind of just adapt. Like you don't realize what you're doing, and then you're like, oh, but then at the end, like the lower left is so hard to see. Every time you're like, oh, number 18, here we go. We can do this. But I don't think no one will understand how hard it is on your body unless they've been pregnant. And I gained like 65 pounds with each of my pregnancy. So I was huge, and it was very different of positioning because I sit pretty close to my patient. Like I'm, and then my belly's like this. So you're like, there's a lot of depth that you have to make up for. So, but I mean, it's just just temporary. So you kind of just have to keep thinking, it's only temporary. But every time I got pregnant again, I felt that anxiety building of like, oh, here we go, at the end, how hard it's going to be for you. But
if you could say, like, in an ideal world, if someone was prepared financially and they had support at their practice, maybe they're an associate, whatever, like what would be the ideal amount of maternity leave? Like maybe some weeks before your due date, and like how long after do you think would be ideal?
So I always worked up to my due date. Like the first one came unexpectedly, so I worked a Friday, had it on a Saturday, and then the next two were induced, and I worked up to a Wednesday, had it on a Thursday, and then I worked on to a Thursday, which was my last day of the week, and had it on a Monday. I would rather take off time with my baby, so I always tried to push that so I didn't take time off before. But ideally, like if you can financially do it, I think the last 2 weeks are so incredibly hard that if you could take, like I was so glad my baby came 3 weeks early with the first one. I was done. I feel like maybe my timing was just off, but I was so done. Like I felt like I was more done with him than with my other two. But yeah, so if you could take if you financially can, I think the last 2 weeks. But if you're someone who's like like you get bored easily, I think you might have a hard time because you're like already anxiety, like you have anxiety about the baby coming. So I think like maybe that might be hard to just sit there and like, oh, what do you do? But there is a lot of stuff that you have to get ready for. So that could be helpful. I took 10 and then 7, not 7. That was too short. I wish that was, 10 and then 7. And then I did 8 the last. 9 I think would be perfect. I never took 9, but 10 seemed too long. I got back and I was like, holy crap. How do I felt kind of like forgotten a little bit. And it was the holidays, so I don't know. And it was my first, so maybe it was more like hormonal, but 7 was too short. 6 would be way short. I would not recommend 6. 6 would be so short. 8 was good. I feel like 9 might be perfect, but I didn't take it, so I don't know. Yeah.
Well, maybe I will someday. I'll send you.
Yeah, you should. Yeah. Let me know what 9 feels like.
So when you picked up and moved your family to Texas, what was that experience like, moving to a new place and trying to figure out, I mean, obviously you had to be within range of where your husband's new job opportunity was, but how did you select like the practice location? I know you kind of mentioned it was through a DSO. You probably found the listing online or something, but how did you guys kind of pinpoint like where you wanted yourselves to live and where you were willing to look for your own office?
Yeah, so I used to work 5 minutes from my practice. Ideally, that was fantastic. I loved it. But we knew where we were going to move into Texas because where his boss was moving, we had to be in proximity of her. Then we looked at school districts actually, and so the school district we're in is a really good school district. But then I was willing to drive 45 minutes max. So then I just looked in the surrounding areas. I wanted to be in a rural town, actually. I grew up in a very rural town, and I love it. I love the feel. I love the patients feel. I my associate, it was more city-like. It was still rural, but more city-like for sure. But I really knew that I wanted to practice in a rural town. I just love the people. I think they're so down to earth. They're very nice. I feel like you get that more like patient feel, like you're seeing them more frequently, and they just, I don't, more like a family, I guess you could say. So I really wanted to, so I looked into rural towns mostly, not big cities. I looked at one like associate in a like into Dallas, and I was like, nope, this is not for me. I cannot do that. That's too much. And like traffic, people, movement. I'm a very need it to feel good. So yeah.
Gotcha. No, that makes sense. I mean, we moved out here for my associate job, and it's kind of similar to what you were saying, like deciding if I'm going to end up doing partnership with this office or what have you. But same thing, we kind of were just looking like drivable to the office, maybe not quite so in the country, like closer to things. We're kind of in between the super rural office and then like the more metro area. So it's like a perfect sweet spot. But
Yeah.
I'm curious more with your family life. I think you mentioned earlier at one point or another you had a nanny. I don't know if you still do, but how did you manage kind of your goals for how you were spending time with your family, childcare, and all of that while also being a dentist?
Yeah, that's a lot. It's a lot, definitely. So when we had our nanny, we had her for 3 years. She was fabulous. We're still like, she's like one of my favorite people. But at that time, financially, we could do a nanny, and then we had started having more kids, and it started to become not so financially available. But I actually grew up, my parents, my mom was a stay-at-home mom and my dad was a dentist. And so I always had that mom at home. And so that's kind of how I grew up. So I wanted to do that same thing for my kids with the nanny. My husband grew up slightly different. He didn't, well, I guess his brother put his kids in daycare because his wife also works. And so we had a different view of daycare. I feel like my family really hounded me that daycare was bad for your kids and that if you put them in daycare, you're going like have these like kids that are, I don't know. They just, in my mind, I was like, I'm never putting my kids in daycare. But when we moved to Texas, we did daycare because nannies here are very expensive. Like it was just not possible. And I wish I would have done daycare with my oldest. It's been like the best thing for my kids. Obviously, there's different daycares. Like you got to make sure you're doing your research and like really making sure that they are, providing what you want for your kids. But my two younger, well, like my baby's just a baby, but my second one is so well more adapted and behaved to like listening and things. I feel like my nanny was fantastic and I love her and I think she did a fabulous job. But it was always like, let's do an adventure. Let's go to the park. Let's go here. Let's go. So my kid was used to like living these like extraordinary days every day. So there was never that like I'm bored time or like this is what we have to do. We have to do some work today and like do some school, learning the ABCs, those things. He never had that for his first 4 years of life. And so definitely I can see a difference between my two kids about that. And then my oldest is always wanting to, he's like, I'm bored. I want this. I want this. I'm like, you're going to be okay. He also has a lot of energy. But I love daycare. I think it's fabulous if you find the right place. And so we do daycare now for my two youngest. And my baby went in at 8 weeks, which is very scary. I think people get real scared about the newborns. I found a place that I felt really comfortable with and small class size. I think there were 6 babies and like only 2 newborns kind of thing. And so they were very, very well trained. So it's real close to our house. It's about 3 minutes. And so my husband does most of the drop off and pickup for me. So my husband's very involved. And I think that's key if you are a working mom to have a husband that isn't thinking that you have to do everything at home. We share, like, we are definitely not the typical, like how I was raised. Definitely, we're like completely opposite. So my husband does most of the cooking, which is fabulous. He does the laundry, which is just great. And so since I commute so far, I get home and my husband has dinner, and I get home like kind of walking through the door and dinner's getting either made or already fed or like in the middle kind of thing. And so he does a lot of work. Luckily, he likes it and he loves to cook. He likes to do the laundry. So it works. It's been working out really well. I do the cleaning. We do share the household, but he does a lot of the actual like day-to-day things. So I always hate my ladies at my office tease me that I never cook, but it just works better for his schedule to do it that way. So that is day to day. And then the weekends, so I feel like this might be guilty, but housework and things we try to do during the week. So like on the weekends, we are like really just having one-on-one time with our kids so that I don't want them to feel like we don't like want to pay attention to them, because our work week is very busy. Like I get home at 6 and then bedtime's at 8. And so it's just like very short amount that I get to see them. But on the weekends, we just kind of like, we have someone mow our lawn so we don't have to mow our lawn, just like so that we can be more involved in our kids. And I bet as they get older, we'll start to like do more chores and things as a family. But they're so young right now that we just try to hang out, play with toys, like go on walks, just really all family time. I mean, we do date nights and things still, my husband and I. We don't like completely kids the whole time, but we try to have the majority of that. I don't have a lot of friends, so I don't do like ladies' night or anything. I'm usually just hanging out with my kids, which is great. That's the time. That's the era that we're in right now with our 3 kids and how young they are. So I like it. It's worked out great. I try to just make sure that I am attentive to my kids when I'm home. It's hard when you get home from work because your mind's still spiraling about like your last patient or, your morning patient you're worried about. So I try to be really attentive. Some days I'm horrible at it and I'm just like zoned out. My husband's like, "Are you okay?" I'm like, "Yes, I'm just worried about tomorrow or yesterday or the day before or last week or 4 months ago," kind of thing. But I try really hard to make sure that like I'm present with my kids as much as I possibly can. And sometimes I'm terrible at it and sometimes I'm good. So yeah.
I love all that. And I think what you said is so crucial. A couple things, but really trying to be present, like leave work at work, go all in on your job of being a dentist when you're there, try to let go of that mom guilt the best you can. But then when you're home, try to be fully immersed in being with your family. I'm sure that's so much easier said than done.
Yeah,
but
for sure.
I think it's the goal people are probably striving for a lot. And then having a supportive partner, like you said, is really like the only way.
I couldn't do it without my husband for sure. Yeah.
Yeah. So before we wrap up, I did want to mention, because I mean, the whole way I even found you was through your TikTok. I love all your TikTok videos.
Yeah.
So what made you want to put yourself out there on TikTok? And have you had any like cool opportunities or reached any new patients you wouldn't expect from that?
So when I was a little girl, I always filmed with my friends, and I would always make movies. And so I feel like it's always been like kind of a thing. And I would get on TikTok and watch it, and I'm like, oh, no. But I just started making it with my assistants, and it's really fun. I like it. I like to change the way people think about dentistry. Dentistry has such a negative feel to some people. Like they hate it. It's anxiety. They hate going to the dentist. They hate, I just wanted to make sure that people change. Like it's a changing development. Like we're just changing the way dentistry is. We're making it more comfortable for patients. We're like thinking about their actual like mental health as well with their oral health. Like I have so many high anxiety patients, but I really try to make them feel comfortable. Like that is my key in life, is to make sure that every patient is comfortable in my chair. And so I think we're kind of just changing the way dentistry feels. And I just want that to get out there and make sure that people aren't scared to go to the dentist. Like I really, really want people to go to the dentist and feel comfortable, not feel like a lot of people feel shame when they go to the dentist. And I hate that. I hate that they would even like think that we're judging them, because we're there just to help them and make sure that they're like, we can get their teeth to the best state that we possibly can with all of their other health issues that are going on and other things in their life. So I just really want people to realize that dentists are fun and that we're not like these, I don't know, weird or like just like crickety, those kind of things. So, and I enjoy it. I used to dance, and so I feel like that also comes into play a little bit. But I also like doing answering questions. A lot of people won't, like, they'll reach out to me and like ask me dental questions, and that's hard because I can't see it, so I don't know what it is. And I hate saying like, oh yeah, it's a cavity, and then, it's a root canal or an extraction. And I'd hate for that to happen. So I try to like just shoo them to their dentist as much as possible. I have a couple people that have said like, where do you work? I want to come and see you. But actually, I haven't had anybody come from my TikTok. They've seen my TikTok, which is kind of sometimes awkward depending on what TikTok it is. But usually it's not too big of a issue. A couple company, like one scrub company reached out to me. That was kind of fun, but nothing. I mean, I just do it really for fun, not for any kind of like, what's the word, like money or anything. It's really just for me for fun, break up my day. I usually do it during my lunch hour, actually. Yeah. Or if I get a no-show, then I'm like, I'm bored. Let's do something. Yeah.
Yeah, that's awesome. Yeah, I started a YouTube channel junior year of undergrad, sharing like the pre-dental stuff, and then I kept it going through dental school, and then now life as a new dentist, and it's super similar to what you're saying, just like kind of pulling back the curtain a little bit. Like obviously every person that's a dentist is super different because they're people, but like showing that we're people, and what life is like outside of work and how we kind of balance things for people that are maybe wondering if they want to go into dentistry, or just kind of like you said, making it a little more humanized and less scary. So I love
For
what you're
sure.
doing.
Yeah.
So I kept you much longer than I said I would because you were sharing so much good info, and I don't want to keep you too long from your family, but do you have any final advice for people that are listening in today?
If you're a pre-dental student, don't feel overwhelmed. It will be easy. Don't let the loans overwhelm you. I feel like I felt like a lot of overwhelming before I started dental school. It will all work out. If you're in dental school, enjoy it. Ask the most questions that you possibly can. Like, ask every professor that you come in contact with questions about their experiences, things that they would have done differently. I would just like eat that information up. I wish I would have done more of that. And then don't be worried. You're going to find a job that's going to fit with you. Don't, like, also, if you're an associate and you feel stuck, don't feel like you are stuck forever. You can do it. DSO is a great option if you're looking and you don't want to like make that huge risk of startup by yourself without having anybody helping you in your corner. I think that's but be very, very picky about which DSO, because I've had classmates and things have different experiences with them, and just be very picky about it. And then if you're just enjoy it, I feel like sometimes I get wrapped up and worried without the day-to-day experiences and the patients, or like overwhelmed with treatment that's coming up. And I have to tell myself this all the time, but try to enjoy the moment because you never know when it's going to be gone.
Awesome. Well, thank you so much. I'll definitely send people over to your TikTok page. I'll tag it and link it and all that in the show. But thank you again so much for your time today.
It was nice to meet you. Good luck with everything. Let me know how it goes.
Thank you.